Intra-articular pathologies can be a very general description of a lot of different injuries that can be happening. We can be talking about hip OA, some form of issues that have been coming up, like occasionally we'll see these tests be positive with labral tears. They can be positive in some kids that have things like leg Cadperthes disease or slip capital femoral. By the way, if you're assessing kids, be very careful, because if they have either one of those two diseases going on in their hip, there's a lot of bad stuff, and they really need to be sent for some kind of testing by an orthopedist, and then also imaging, diagnostic testing. And then they'll probably have to be off their hip for a great deal of time, because otherwise they're looking at a hip replacement, when they're 10 or 12 years old, which nobody wants that. So when we're going to talk about this, the first test that we're going to do is the Flexion Adduction test, and the clinician actually really doesn't do anything. The patient is going to actively flex their hip to 90, and then you're going to have your knee bent to 90, and then they are going to let their leg come all the way across, and their knee should be at least in line with their opposite shoulder, and then they would bring it back and do the opposite side, and they should match. They shouldn't have pain when they're doing this, and the pain you're looking for is going to be usually like a deep-seated pain that they can't touch. It can be achy, it could be sharp, they might feel like catching or popping when they do that kind of stuff. There's all different kinds of things that they might maybe report. If you can slide this way just a little bit. The next one is the hip scour test. If they have something going on inside of the ball and socket joint, so between the femoral head and the acetabulum, they will probably really not like the hip scour test. I'm just saying, because what you're going to do is you are going to take their hip and you are going to try to jam the femoral head into the acetabulum pretty much as hard as you can. So you're going to flex them up, and then you're going to bring them out into abduction, and then move them through an arc out here, pushing straight, like I'm pushing down the length of her femur into her hip, and then you'll bring them into adduction, and again pushing down the length of their femur and going through an arc as they're doing that. And you can even take them across the top and across the lower part of the arc to jam it in there as well. If you notice locking, catching, clicking, popping, or they feel it, that is a positive test. Pain obviously is going to be a positive test, but again, we're not looking at the SI joint, we're not looking at the hip flexors, we're really talking about deep inside of their hip. And the problem with this is sometimes they have a hard time identifying exactly where the pain is. People can complain of groin pain, pubic pain, low back pain, butt pain. They don't always know that it's happening in the ball and socket joint. Another test, again, weird, FABERs. FABERs is positive for a lot of stuff, which is why we have to make sure that we're asking specifically what kind of pain they have and where the pain is. And then the last test is the Ligamentum Teres test. And for this, what you're going to do is take their leg and move them up into full flexion and see if that bothers them. And then you're going to bring them back down into about 70 degrees of knee flexion with 90, or hip flexion with 90 degrees of knee flexion. And then what you are going to do is you are going to internally rotate their hip. And really, I would go back and forth from internal to external rotation as you're doing this to see if you can apply any kind of tension on that ligamentum teres. By the way, the ligamentum teres, you have your femoral head and the acetabulum. The ligamentum teres is that ligament that attaches the femoral head into the acetabulum, and with that there are arteries and veins that run through there that give nutrients to the head of the femur. So if anything has happened to that structure, and usually we would see that with something like a subluxation or dislocation, so they should have had a pretty big pathology go on in their hip for that particular test to be positive. But those are the main tests that we would look at for these different types of pathologies within the hip joint.